start? If anyone else drops in, they can just join later on. Okay, so thanks everyone for coming. I think we'll just do a little bit of a round of introductions. So I'm Emma. I am the professional qualification lead for Rowlands Pharmacy. I lead on the foundation programme for England, Scotland and Wales. And we've got our panellists today. So we've got Molly, Anna, Shafan and Shubby. So if I'll hand over to Molly, who can introduce herself.
Hello, everybody. Welcome to this webinar. I'm Molly. I'm a fourth-year pharmacy student at Kingston University, London, and I'm also the publications officer for the BPSA. Not sure
Anna.
who'd like to go next. I'll hand over to Anna.
Hi everyone, my name is Anna. I'm a trainee pharmacist in Ralstoke Hospital, ex-Kiel, and I'm also the EPSA officer for this mandate. Nice to meet you. Hand over to Shafan.
Hey everyone, I'm Shafan and I'm the third-year pharmacy student at the University of Huddersfield, and I'm also the BPSA's Pennine coordinator. I'll hand over to Shubi.
Hello everybody, my name is Shubi. I'm currently a trainee pharmacist and I am the IPSF officer for this mandate. Nice to meet you all.
Okay, thank you everybody for joining. We're going to open this webinar today with a little quiz on Mentimeter. So if you guys are all able to, please pull out your phones and join the Mentimeter when we get it up now. Anna, do you want to, should I stop sharing my screen?
Thank you.
Yeah.
Just give me
I think somebody raised their hand. Did I see that right? No. It's okay, carry on.
Can everyone see this?
Yeah, we can see it. Thank you.
Okay. I'm just gonna give a couple of minutes, maybe 2-3 minutes, just for people to join. You can use the code at the top. So it's 81275309, or you can scan the QR code. Okay. Can I make a start, or is there anyone that wants to still join that hasn't joined yet? Okay. Right. There will be music, just a disclaimer. Okay. About 15 seconds. bit of a trick question. And the faster you answer, the higher you go. With you. Okay, so this is the leaderboard for now.
Someone's just asked if you could turn the music down.
I don't know
Possible.
if that's anything. Does that make any difference?
No.
Oh,
Someone said it's quite hard to hear over the music.
wow.
It's up to you if you want to turn it
I
off.
don't speak much. Sorry, I can't. It's just it's not non-rock. That's good. The last question. Hey. Again, and take screenshots that we can First place, I think. Or was it the first? Oh, that's ever. Right.
Well done. I hope everybody enjoyed that. I know I did with the music. That was
Sorry for
really
giving
fun.
everyone
Thank you,
a
Emma.
headache. I'm sure everyone's awake now. Thank you.
So let me just share my screen back to the slides. Okay. Hope everybody can see that. I'm gonna pass back over to Emma now. She's just gonna talk for a couple minutes about what she does at Rowlands.
Thanks, Molly. I hope everyone enjoyed that. It was a little bit of fun to get everybody going. Okay, so tonight's session is about supporting you. So how to deal with exam stress, how to deal with those situations where you're feeling the pressure. And we've got a great panelist here tonight who will be able to talk through their experiences and how they deal with exam stress. So for Rowlands, we have foundation trainees in all three of the countries, so England, Scotland and Wales. And in terms of support, each country is different. So if you've not yet started your foundation training year and you're thinking ahead of for next year or the year after, just a bit of an overview of the support that we have for when you are in that situation. So in England, so we have monthly clinical study days via our third Pioneer Primary Care Training. So each month our trainees will go away and have a specific study day around different topics. And then towards the end of the year, they will support with calculations, mocks, GPHC mock assessments, which are really helpful and useful. And then in Scotland, it's a NEST-led study programme, which is a mixture of hybrid and in-person training. And again, they will cover with the same sort of exam style topics towards the end of the training. And again, it's the same for Wales. Next slide, please, Molly. In terms of dealing with exam stress, and I think the panel will probably cover this in a bit more detail, top tips for me to you would be to get plenty of sleep. Sleep is really important. Make sure that you take regular breaks, lots of exercise, and create a revision timetable. So these are the sorts of conversations that I'm having with our foundation trainees at the moment. So make some time, whether that's half an hour in the morning or half an hour to an hour in an evening. Just make sure you are getting some time in there to revise, but make sure that you're making time for yourself. So going to the gym, socializing with your friends, I think that is really important. Eat healthy, and most of all, ask for help. So if there's something that you are trying to revise and you just don't know the answers or you're really struggling, ask. It's so important. So they're just a few top tips from us, but I think the panel will be able to cover their experiences in a bit more detail. So I'll hand back over to Molly.
Thank you for that, Emma. So now we're going to move on to a panel type discussion. You should be able to see at the bottom of your screen, I believe, a Q&A button. If you have any questions, please feel free to pop them in there and we will try our very best to answer them for you. So the first question is whether a recording of the webinar will be sent. This webinar is being recorded. We will be posting it on our YouTube, the BPSA. Our YouTube is on the front slide. Let me go back to that. See all our socials down here at the bottom, and you should be able to find the recording for the webinar down there. So I know we all introduced ourselves before, but I'm a fourth year, Shubi is a foundation trainee, and Shafan is a third year pharmacy student. So we're from, different stages in our pharmacy journey. So if you guys have any questions for us, whether it be, about a specific topic, like, I don't know, medicinal chemistry or calculations and how to revise for that, etc., just please pop them in the box and we will do our best to answer them for you. So the next question is, when would it be the best time to start revising for exams? Not sure if that's referring to just exams in general or the GPHC exam, but Shafan, would you like to answer that?
I think I've got an idea of an answer. So like my number one like failure was leaving everything way too late or realizing in a week's time there's going to be an exam. But only now am I starting to actually understand. So when it comes to finding out when your exam is, I think the number one thing is actually listing when everything is due. Because I know that obviously we're all in different stages of pharmacy, but especially for third year with myself, we're just having assignment after assignment after assignment. And now the deadlines are all coming up week after week. So it's not good enough to turn out that, oh, by the time you finish one deadline, you've just got a calculations exam in a few days. So I'd say number one thing is list and find out when your exam dates are, mark them specifically, and then start early. And then from there, you can properly navigate your time between revising for the exam and also revising for whatever assignments may be happening at the time. Hope that helps.
Thank you for that, Shafan. That's really good advice. Sue? Well, Sue, actually, you haven't introduced yourself yet, so if you'd like to introduce yourself first.
Hi everyone. Sorry I'm late. My name is Sue. I actually only qualified over summer, so I'm a pharmacist now, which feels a bit weird to say. I actually came from another meeting, which is why I'm late, so apologies. But I thought I would just give insight, in case it was from a trainee perspective of like when to revise for the GPHC exam. I would say that's really variable, because you have to take into account lots of things like, what's your day-to-day looking like? What's your workload like? How confident are you feeling? Um, is it clinical? Is it calculations? What's your weak spot? I think for me, I knew maths was kind of the difficult bit, so I started revising maths quite early on. And early on, I think was around February. Not February, that was more clinical after Christmas. No, December for maths. But it really depends because if you're really happy with maths and it's something that you've been quite confident with throughout university, maybe you start around Christmas time, but I would say it's never really too late to start revising. And I feel like with maths it's little and often, whereas clinical, because you're kind of always in a clinical setting, and depending on where you are training, you're kind of getting a bit of clinical every day. So it really does depend. And I think I would personally do little and often, and then kind of ramp it up towards the exam time. But if you're kind of looking for months, I don't recommend specific months because I think everyone's a bit different. But for me, what I did personally was maths before Christmas and then clinical like from Christmas onwards. But I think I started quite like heavy with revision just because I also was part of BPSA last year, so actually my personal commitments were quite heavy as well. But yeah, I hope that helps.
Thank you, Sue. I think little and often is probably really good advice. I know from previous experience that that is often the thing that people fall down to a little bit because they kind of leave it all to the last minute. So I definitely think that's really good advice. Thank you. Shubi?
Yeah, I just wanted to add that that's what I'm basically what Sue said I'm doing right now. Me and my other trainees at my training place, we decided to just start off with like 5 questions when we can during the week. So we try to do it 3 times a week from 5 clinical questions and 5 calculation questions. Just like Sue was saying, obviously, listen and often is more bearable, especially you don't want to burn out very early on in your training year. You want to be able to obviously withstand, obviously, maybe the stress of your training and also to be able to revise because it's not easy to do both. So, obviously, if you do something that's within your capacity, you learn more and obviously absorbing a lot while you're on the actual job. So, I think, yeah, I agree with Sia. I was just going to add that.
Thank you for all your answers, guys. We'll move on to the next question now. And the next question is, how do you guys manage revising for end of exams and keeping on top of notes? are there any tips for writing a lab report, for example, websites? So I'll just start off quickly if that's okay with you guys. I think in terms of end of year exams, I think it's really important to start making your revision material early. So the tip that helped me quite a lot was somebody said to me, you should make your revision material in the lecture. So what I try to do is when I'm in a lecture is make my flashcards there and then, because I actually go back to look over my flashcards, whereas I don't go back to look over my notes. But obviously it depends on what kind of revision material that you use. But I find that really useful because it saves me a lot of time because making flashcards is very time consuming. Um, yeah, I think I'll pass it on to you guys if you have any tips. I personally, I don't think I've ever written a lab report except for my dissertation. So I'll hand that over to you guys if you have any advice. Sue?
Yeah, I think note taking was something I always felt obligated to do at university as well. So I kind of see where you're coming from because you always want to finish on notes and then revise. I don't know what it is about having a full set of notes that's really satisfying. But I think it's about knowing the way that you learn. So actually, note writing for me wasn't really the best way because I found that I was kind of copying off a screen or copying off someone's voice recording, but I wasn't really actively taking in information. I think um for me, the best way was to talk everything through with somebody else. So I revised with different friends because it's easier to see a topic from someone else's perspective, and also see if you're sharing that perspective and if there's a discrepancy, there's something to iron out between the both of you. And I think it's actually a lot faster, but also a lot more effective at testing whether you understand something or not. And I also really like mind mapping on a blank sheet. So I normally just sit with a blank piece of paper and then I don't know, say if I was revising hypertension, maybe I'd have hypertension in the middle, and then I'd have like the med chem of the associated meds, and then the pharmacology, and then the clinical stuff. So like the pathophysiology, what's the like meds management, and like the treatment for it, and then any contraindications of common meds. So I think it's how you learn. For me, I kind of like my maps because everything's in one place. I can like pharmacology, med chem, and clinical together on one page, and it helps me visualize it a bit better as well, and it highlights gaps in your knowledge very quickly. I think it's very intimidating though, when you have a blank sheet and it's like, what if I can't put anything on there? But I think you just have to know that in the exam you also have a blank sheet. So it's kind of like either now or the exam. So I would say once you're over that fear, it's really good. I think it's a really good method to revise. And I think in terms of lab report writing, I couldn't find a website personally. I would say the easiest way is just to ask somebody that knows how to write a report. And once you kind of have the basic structure for it, you'll, I think, yeah, you'll just know how to do it. So a lot of people, maybe that study science might have a better idea of how to write lab reports. I don't know, I think because I learn a lot from speaking to other people. I would make friends, I don't know, with people from other subjects and other degrees, especially more scientific ones who are really used to writing a lab report. Or even just going to ask someone else from your cohort that knows, or asking like another PhD student, or asking a lecturer.
Thank you for that, Sue. Shubi?
So my personal experience of writing notes, I'm not the best at writing notes, but what I started to do towards the end of my degree was to look at, so basically every year obviously has like the list of outcomes for lectures. So I used to take the list of outcomes for lectures and put them into different title pages and kind of summarize my notes on those pages. That's why it answers that learning outcome so that I'm at least satisfying the most information I can while just obviously summarizing in a way that's easier for me to revise. So that's what I used to do with that. And in terms of like group sessions, that I think similar to what Sue was saying, that we used to just revise together and we used to teach each other. So we would test each other on the topic by saying, teach me how to do this, teach me how to do that. And we successfully obviously got through it because by teaching somebody, you're basically reinforcing that information in your head, and it's easier for you to repeat if it's repeated multiple times. For lab reports, I would say that a lot of unis actually have how to write a lab report. If you search it up, a lot of unis do have like a website where they teach you how to write a lab report, and maybe your uni may have one. I mean, well, not in general, actually. Yeah, maybe your uni might have one. I wouldn't say that all unis have it because personally for me, my university, they gave us like a guide to a lab report. They gave us like when we were tasked to write our first lab report. And then they additionally what they did as well is had like a little like checklist that we could use to see that we got all the sections correct. And you might also want to look into maybe peer schemes in your universities. There's like groups that you can go to that they're probably the more senior students, and they obviously have that experience. Because my one had, and I attended a session, and they just basically went through how to write a lab report. Obviously, it was more not pharmacy based. It was obviously more based towards science because it was a different type of word count. But I did take a lot from that, and when I was writing my dissertation in the end, it was easier for me, basically. So I would say, those are the two tips I would say is that just have a look on the internet, how to write a lab report, and a lot of unis should come up. And the second is look at maybe a peer group in your university.
Thank you for that. I think we'll move on to the next question now. Thank you for that question. The next question is asking, how can I revise for pharmaceutical chemistry? Well, that is a challenging topic. I can't lie. That's one that I found challenging. Anything to do with chemistry. I think obviously it depends on what uni you're from, but I know for us, we had a lot of workshops for pharmaceutics and chemistry as well. And I would often use the notes that I had from the workshop and the workshop questions to practice. I think that doing practice questions is a very, very useful tool, but I think for anything chemistry related specifically, it's even more useful because it teaches you how to answer the questions, which I think sometimes people find quite tricky. Shafan?
I don't have much experience. Like for pharmaceutical chemistry, that module especially, I like to draw. So the main things that I did, especially with all the molecules and those sorts of drugs as well, is try and draw out as many of the mechanisms as possible and as many of the formulas, just so I could actually visualize it. Also, my main thing is actually just going to the lecturers, even when it's after a lecture or when you don't want to, when you don't feel like you want to speak to them when everyone's there, going to them and getting them to draw it out for you or getting them to actually almost spell it out for you as well was actually really helpful for me because it got me to really understand what was going on rather than just get whatever question it was to answer, but actually understand what's happening. So that's what I'd say. I wouldn't use textbooks so much because then I got a bit lost in it sometimes. There's too much info.
Thank you for that, Shafan. See?
Yeah, I really struggled with bedcam as well. I think for me it was trying to remember the structures of different medicines. And I think what was helpful was try to remember, say, like the basic structure of one drug class. And as long as you remember kind of what looks the same for everything, and then just try and remember like the changes rather than each drug as a structure itself. Because if you have like the basic structure, you kind of can work out like the bits that are different and then try and understand like the differences. So if like one bond has changed, like what does that affect, and why is that different clinically? And then I think another piece of advice would just be try to draw the mechanisms with like the right arrows. I remember always like getting the full arrows and like the half arrows mixed up. And by trying to understand like kind of say where electrons are transferred and things, I think really helps you be able to like see where the bonds move. I don't know how much in detail you have to do it, but I remember when I did med chem, it was always electrons, and I always used to get them wrong. So I think fundamental understanding, rather than remembering just a picture of the mechanism, because I think it's quite impossible. Like once you understand it, you can kind of apply the knowledge a little bit better. And as for structures, you just have to keep on drawing it out until you are really confident with it, and then you can kind of manipulate the reaction afterwards.
No, definitely, for sure. Thank you, Sue. So moving on to the next question. This is quite an interesting question, actually. Is it okay if I use ChatGPT to summarize my notes? I personally think, in my opinion, AI is a very, very useful tool when you use it correctly. I do use ChatGPT sometimes to summarize my notes. I use it, sometimes it comes up with quite good quizzes if you're trying to revise a certain topic and maybe you don't have any practice questions. Often I ask ChatGPT, ask me 10 questions on gout, and it does test your knowledge because sometimes I ask questions that you know, in a different style to what you're used to seeing, and it does test your knowledge. And so I think if you use it in the right way, it's very, very useful, and it's definitely okay to use it to summarize your notes for sure. Does anyone else have anything to add? Or we can move on to the next question. Shafan?
This is a tricky one. Like, with it, I do use ChatGPT a lot for university as well. Sometimes it can be useful, especially like if you are somebody who is wanting notes and wanting to do them bulk, it can be useful as well, but it really isn't enough if you just say summarize this entire presentation and then you never look at it again. So if I was to use it, it would be like doing sort of the bulk of it, and then actually I'd have to methodically go through it, check that it's all there, because you know that it either misses things or it doesn't get it right or it references things wrong. So I think you can use ChatGPT so long as you are working alongside it, and everything that you're asking it, you're double, triple checking yourself to make sure that it's all right, because it can be very tempting just for it to do your entire module for you without you realizing.
Thank you, Shafan. Sue?
Yeah, I kind of agree. I think it's inevitable when if ChatGPT is there, you just want to use it. But I think it's similar to what everyone was saying, it's how you use it. And for me, I kind of prefer to be asked the question rather than type in the question, because I've typed some in and the answers sometimes are quite questionable. And I think sometimes it can get confused like with some pharmacokinetic data. And some drug classes, and sometimes it says something is long acting and it's short acting, and it can't tell the difference with like what's just in the middle. So I think you just have to be a bit careful with it. But in terms of like getting a fundamental understanding, I think ChatGPT is really good at that. But in terms of nitty-gritty, then it's probably worth you looking into something a bit more reliable of a source. But I think definitely get it to ask questions is really good because it makes you look at the topic from lots of different angles, which is really good for your learning.
Yeah, no, for sure. I think it's very important to note that ChatGPT is not always factually correct. And that's a very important thing to remember. And also, I think the key thing to remember is that there are loads of different AI platforms. Not that I'm promoting that you use AI all the time, but it can be used like as a search engine. And I'm gonna let you guys into my trade secret now. There's another AI platform that I use. It's called perplexity.ai. And when you search something through it, it gives you the answer with sources. So if you're looking for references or you're looking for something that's a little bit more factually correct, use that because it's really, really good and it gives you the answers and it tells you where it got the answers from. So that's very useful. Okay. Think we'll move on to the next question. How do I revise for OSCEs and how to be calm in OSCEs? I'm still trying to work out the answer to the second part of that question. I can't lie. I'm never calm in an OSCE. I think it's inevitable because it's a very scary situation. Um, but I think this one of the things that does calm me down when I'm in an OSCE is I try and remember that the person marking you, they do want you to pass and they want you to do well. And they want to hear, you know, all the things that they want to hear to give you the marks. So you're kind of working together in that sense. And I mean, and it doesn't always help you keep calm. It's very stressful. Um, but yeah, just trying to remember that the person really does want you to pass at the end of the day. So hopefully they should be nice to you. Not sure if anyone else has anything to add to that. For us fourth years this year, we have a 12 station OSCE, so I do feel your pain. It's very nerve-wracking. I'm already nervous about it and it's 3 months away. But in terms of revising for OSCEs, it's hard because I think I personally revise for OSCEs in two stages. The first stage, I go over all the content that I need to know, but make sure I know what are all the different clinical conditions that I need to know, all the drugs, or the main side effects, any red flags to look out for. during an OSCE, and I revise that using my revision notes, my flashcards. And then after I've kind of learned the content and I'm confident in what I know, I move on to practice scenarios. And I think these are really, really key. And these will also teach you how to be calm in an OSCE as well, because you'll have practiced it so many times that by the time you get to the actual thing, you'll know what you're doing. And this is actually another area where I find ChatGPT to be quite useful, because it does come up with, OSCE scenarios. Oh, like I don't know, a 35-year-old woman comes into the pharmacy, wants emergency contraception, and you can then through it yourself. So yeah, I'm not sure if anyone else has anything to add. See?
Yeah, sorry, I feel like you're hearing a lot of my voice tonight. But I think for OSCE, it can be something quite methodical. So, often, I went to East Anglia. We had like a mark scheme for your consultations. So I think if you're someone that really struggles to kind of structure a consultation, um, using a mark scheme is a really good place to start because it kind of marks you on like your body language and how you structure it. So your introduction, trying to info gather, info give, close safely. And I think by kind of having a checkbox structure, it helps you like deliver content and like get content from the patient in a really methodical way until you're really confident and it starts to come a bit more naturally. And I think what I find really odd about OSCEs is that I feel more nervous doing an OSCE than actually speaking to real patients because I speak to patients every day now and I feel fine. But in an OSCE, like everything changes and suddenly everything you say you're second guessing, and everything you say it feels wrong. But I think if you've revised for it and like your blood pressure meds and are always going to be blood pressure meds, like no one's really going to trick you. And I think as long as you know your red flags, you know your contraindications, and you're asking the right questions, your safety netting, I think it's just kind of having the confidence and trying to reassure yourself that you've prepared to the best of your ability. No one's going to try and catch you out, as Molly was saying, like they actually want you to pass. And that ultimately, if they were a real patient, you would probably feel fine because you actually do know a bit more than you think. So, yeah, and I think practicing with people also really helps just to build confidence into the way you're presenting yourself to other people. So, definitely recommend practicing with people.
No, I agree with everything said there 100%. And I just want to add on quickly at the end that it's also important to learn very easy marks that you can get. For us, we get marks for introducing ourselves. We get marks for asking, "Oh, do you need a chaperone? Do you want to go somewhere more private?" We get marks for safety netting as well. And those are very easy marks that if you bring into every consultation or every different OSCE station, you're definitely gonna get a lot of the marks just from remembering all of those basic things that you need to cover. Okay, moving on to the next question. How to calculate complex dilutions. I get confused on the different steps and which ones to do first, etc. It's quite a hard one. I think with calculations, me personally, it's all about practicing and practice, 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 and you just kind of get it drilled into your head exactly how what steps to go about and which steps in which to do the calculation. And I think what I like to do with calculations is at the start, I practice the question with the steps in front of me. And then when I feel comfortable using the steps, I take the steps away and I see, oh, can I remember it with more questions? And then usually I get better and I get into the swing of it and so on and so forth. Should we?
I was just going to say for complex dilutions, what I recommend is looking at YouTube videos because there are different ways of actually doing those calculations. I've realized, especially now that I see my fellow trainees, they're talking about the ways that I wasn't really aware of. Um, especially obviously now that questions they give a lot of context, so you get confused before you can answer the actual questions. So if you know how to highlight those parts and then put into any like different type of way of answering the question, it'll be easy for you. If you know like there's a way for you to do it easier, should I say? I'll be like, basically the main thing is like just find a way that works best for you to do that calculation, especially complex dilutions. It's not easy for me. That is my weakness as well. Complex dilutions is my weakness. So I've done a lot of practice on those. And I think there are a few resources online actually. I can't remember, but I think University of Kent have like those kind of pharmacy calculation books that give you a step by step to see how to complete the calculations. I think it's quite a good one. And obviously I'll say just go back to basics and go to the introduction into pharmacy calculations and go through those and practice.
Thank you for that, Shivi. Okay, I think we'll move on to the next question now. I have found myself quite behind with lecture notes. What is the best way to catch up and make the most of my time? So I completely understand your pain. Pharmacy, there's a lot of lectures, and staying on top of them is really, really difficult. For me, one way I find that helps me the most is I take a day a week, usually either Saturday or Sunday, and I go over all the lectures from the week and make sure that I have all my notes in place. Um, I know this is hard because I know people work weekends. That's personally what's worked for me. And it just gives you a bit of time to just sit down, focus, like reflect on the week, go over everything, maybe spot areas that you might need to work on understanding a little bit more if you haven't necessarily understood it from the lecture. Um, yeah, I'm not sure if anyone has anything else to add. No. Okay. Thank you for that question. I think we'll move on to the next question now. What additional sources would you recommend to practice calculations? For me, I know in the library we have about 50 different books on calculations, and in exam season, the shelves are empty because everybody's taken them out, and they're really useful. We also get, for us personally at Kingston, we get a lot of practice questions just given to us by the lecturers from the workshops. So I use those to practice as well because they're most like what are gonna come up in the exam. But yeah, I definitely use textbooks, and I know a lot of other people use textbooks as well. I think there's like it's like a yellow textbook, pharmaceutical calculations, that everybody uses, and that one's really useful as well. So definitely see if they have it in your library, because that's really useful. Okay, moving on to the next question. How how do you manage to balance studying with social life, especially coming closer to exam season? Feel you with this one. It is tricky. It is tricky. I think, Sue, you go first.
Yeah, I really struggled with this, and I think it's something that I struggle with now. I always thought once I'm working, I'm gonna have a social life. I still don't really have much of a social life, just because I feel like I just do a lot of side work as well. But that's a personal thing. I think it's inevitable to be honest to keep the two distinctly different. I think, for me, what was important was that I was still interacting with people because it's really easy that when you start studying, you just isolate yourself. And that's what makes it really difficult and lonely and just really long. And it feels like a period that never ends. But I feel like once I started revising with friends, it was a lot easier. And sometimes you don't have to like always talk to them when you're revising. And sometimes it's just having someone with you when you're revising that makes you feel like less lonely. Um we'd always like treat ourselves as well after revision. So I don't know, say if you've done like a good few hours, you're like, okay, let's go grab mine used to always be bubble tea, so we'd order bubble tea to campus. Maybe a bit too much towards towards like the end of the exam season. But I think it's just doing things that you like with your friends as well as studying, because often you're in the same boat. So you both know that you have to revise. You both know that you can't keep revising all day. So as long as you're building breaks regularly into your day. And I would say try and keep the timetable quite consistent and try to do the same thing every day. So you're building a routine because it doesn't feel as tedious. If you're trying to change things up every day, your body can't really get used to it. I think for me, when I found that, I started sleeping a bit more regularly, and I think meal times at regular times is really important because you can be like, okay, eat like, I don't know, 1 to 2 or 1 to 3 times a day. Whenever I get hungry, it makes your body a bit confused about when to sleep and when to wake up. Or maybe that's just my body, I'm not sure, but routine does really, really help. So I think set an alarm of when you're going to get up. Um, like be wary about your when you're eating. And then when you're having a break, your break could be when you eat with your friends. And then actually when you're working, like make sure you're working and not doing something else. Because if you're doing something else and then taking a break, you're also not feeling productive, or like prepared for your exams. So I think that's kind of how I would structure my day when I was revising for exams. Hope it helps.
That's definitely really good advice. And I think as well, if we think back to what Emma said a little bit ago about having a revision timetable, if you make a revision timetable, schedule some time off as well. Like you don't have to be studying 24/7, and that's definitely not good for you either. So make sure you schedule some time off. So say, oh, or you want to go out for dinner next Friday, make sure you put that in your timetable. And then when you do take that time off, you're not going to feel bad about it because it's in the diary, you know? Okay, next question. Sorry, excuse me. How do you manage exam stress when you feel like you are not prepared enough or don't have enough time to go through everything for exams? I feel you with that one. I know pharmacy is very content heavy and there is a lot to revise for exams, and it does feel overwhelming. I think for me, I like to prepare in advance. This is just me personally. I really like to start revising early. I like to, even like a little bit every single day, even if it's a couple months in advance, can make such a big difference when it comes to the actual exam. And I think if you're doing little and often, you're gonna start feeling more prepared than if you just leave everything to the last minute. And I know that it's easier said than done, but making studying for say hour a week or maybe more than an hour a week, just for instance, I say I'm going to revise for 3 hours on a Saturday afternoon and do that every single week. You're going to feel way less overwhelmed when it actually gets to exam season because you're going to be more prepared. And I'm not sure if you guys have seen, we always get told about this at uni, the forgetting curve, and how you have to remind yourself of a topic every so often so that you don't forget it. And I think that it does ring true. If you go over something little bit but often, you're going to be way more likely to remember it than if you just go over it one time before the exam. Sue?
Yeah, it's just a quick one. I think if you're struggling with content, try to look at the overlaps between topics and try to revise the overlap and see how it links to two different things. So one example that I would like to use maybe would be like say dopamine that's involved with like Parkinson's, plus also things like your mental health meds. So by understanding like what one thing is can actually help you understand two topics. So yeah, finding overlaps in your learning might help reduce the amount that you have to learn.
Ruby?
I was just gonna add, like, you could also have, obviously, if you have exam questions or past paper questions that you can try and then use them as progress checks to see how much you've learned since your last revision session. And then using that, you can also see what topics you may need to focus on and obviously do more work in before the exam so you feel more prepared. So those little small progress checks, so often will help with obviously understanding where you're at in terms of your level and then what you need to do to make sure that you feel a bit more confident for the exam.
Thank you, Shubi. Shafan?
Mine is just a quick point, but this is more towards everybody who does feel like they haven't done enough. firstly, at this stage, there is enough time to go through everything. You're not too late to like start giving up or start sacrificing everything because it's too late. There is enough time to get the work done. But also for me, when I did start to feel like that slightly, I did like get friends to help us as well, either because they've already covered it or they used to teach us as well, or I'd use them as like a lecturer almost as well. Because that way they'd give us like a small crash course. So firstly, it isn't at that stage yet for you guys. It is not too late to like start revising and to get everything done. But if it does get closer to that time and you are still feeling like that, please do take help. Like, don't keep it to yourself or get more worried about it.
No, definitely. That's really good advice. Thank you, Shafan. Next question. Oh, interesting question. Doesn't necessarily apply to everybody, but someone's asking for tips as a student who is also a commuter. Can I still pass the year? I'm personally not a commuter, but I just want to say instantly, yes, you can still pass the year. I know so many people who commute 1, 2 hours a day, and they've all made it to fourth year. So that's a good sign, isn't it? Shubi?
Looking from somebody that commutes and still commutes to this day. Yeah, you can definitely pass. Look at me, I'm actually like a trainee pharmacist, so I can definitely tell you that you will be able to pass the year. I think as my advice to somebody that is a commuter, try and make some time for yourself as well. I understand like it's obviously going to be a bit stressful because you're worried about obviously exams and everything, but try and take some time for yourself because that's what I did during the time I was commuting. Because I was like, it's getting a bit hectic. So around exam season, so make sure you make time for yourself and also know where to go for exams. Because if your exams are off-site from your university, always know where to go so you're not stuck in limbo, basically.
Thank you for that, Shubi. No, I think it's always good to hear from a fellow commuter. Okay, next question. Could you explain about the oral procedure? Do I necessarily have to have pharmacy related work experience to include in the oral application? No, you don't. Long story short, you don't need pharmacy work experience to include in the oral application. In terms of the oral procedure, I'm not sure if anybody wants to give a brief overview, or I'm happy to. No? Okay, that's fine. So I've literally just come to the end of the oral procedure. It feels like a long time. It spans over a year. It kind of starts around like April, May when you're in third year, and then you get your offer around November, December-ish when you're in fourth year. So it's quite a long procedure. In terms of how it goes, well, you have to sign up to Oriel and you do an initial application. This will all be thoroughly explained by your uni. They often have a person who's dedicated to covering Oriel. Then after you've kind of done your general application, what we call it preferencing, that opens, and that's where you get to see every job that's available in the country. Usually it's about 4 or 5,000. But you can filter through that depending on the location you want, the kind of job you want, whether you want a split sector, and so on and so forth. You get around 2-ish months to preference everything that you want. So you have a lot of time, so I wouldn't be stressed about any time constraints with that. Then you have to sit a situational judgment exam, and this is like a 2-ish hour long exam where you go through basically a load of scenarios and you have to say what you would do in those scenarios. Based on how you do in that exam depends on whether you get your top choice or whether you get, your second, third, fourth, fifth choice. But I wouldn't stress too much about Oriel until you actually get there. I it really comforted me when I found out that basically everybody gets a job at the end of the day. So I really wouldn't stress about it. There's not really a shortage of jobs. Everybody I know has got one. Um, so yeah, that's a very brief overview though, and I think we will possibly be doing a webinar on Oriel at some point. So if you feel like you need any more help with that, please feel free to come along to that. Okay. So we have come to the end of our questions. If anybody has any more questions, please pop them in now. I'll just give around a minute to see if anybody has any last burning questions that they'd like to ask. If not, we'll go on to the closing remarks. So we've had another question, about Oriel again. How do you apply for cross-sector? Do you have to rank your options separately for both, or is it just one list of ranked options? So I don't know how to explain this. So with Oriel, Shabi, do you want to explain?
Basically for cross-sector, usually it would be like together as one program. So you can rank it. It should usually be like, for instance, I'll just use an example like GP and community, they'll be together and it will say both of the locations where you'll be completing that placement, and then you'd rank them. Um, and for some hospitals, for instance, as well, they will say like a GP or they'll have their own full 12-month hospital program, and then you would rank them like that. So you don't necessarily have to put them into a separate list. You just have to preference obviously what you want by just reading what is detailed on the program description. So you get an understanding of if it's cross-sector or not, because it will basically say 6 months here, 6 months there, or 3 months there, 9 months there. So yeah, to answer your question, long answer short is no, they're together basically.
Yes, that was what I wanted to say. Thank you, Shabi. And another question, can I choose the combination myself? No. As Shabi said, it's one job post with multiple rotations. So if it's say like a hospital community split, it'll be one advertised job, but you'll have 2 rotations within the year. Hope that makes sense. We'll just hang on a sec to see if there's any more questions. No, I don't think so. So I'd just like to say a big thank you to everybody who came to this webinar. I really hope that you found some of these tips useful. I know I definitely got some tips from other people as well. And thank you for coming. And then I'm just going to direct you guys back to our social media pages if you don't already follow them. Please feel free. We've got the website, Instagram, Twitter, Facebook, YouTube, and we also have TikTok as well now, which is very fun. So please feel free to drop us a follow there, and you can keep up to date with all of our latest news, all of our upcoming events. We have annual conference coming up very soon, which I'm very excited for. And I hope you guys have a wonderful rest of your evening. I'm not sure if anybody else would like to add anything to that.
Just to say thank you. Thank you all for taking up your evening and coming along to the webinar tonight.